So we're gonna do joint compressions
Joint compression.
now.
So right now the only joint compressions we have is for the knees. So like all of our knee exercises, or all of our hind leg exercises, let's make sure that we start with the hip in a neutral position. So the hip isn't up here and it's not far back either. It's right here. So the whole leg is neutral. And then joint compressions are a compression but not a pull. Okay, it's just a pull is a traction. So compressions are just, you know, a squeeze. So there's options of where you want to hold around the knee. I think that's up to you. I'll give you 2 different options for what may work. Oh, sorry.
Hi, Ivy. Okay, so we were talking about joint compressions.
Okay, so we were talking about, I was going to tell you that there's 2 different ways that I do it, but there are other ways, whichever kind of works. So the knee joint is right here. So one way is holding really close to the joint itself. And here I'm just doing little tiny oscillations. You can see the skin doesn't look like it's moving because it's not. It's just squeeze together, release, squeeze together, release. I'm not pulling apart, I'm squeezing and letting go. Squeezing and letting go. Another way you can do your hands that might be easier is if you hold kind of around the ankle's kind of like a hook. And then I put my fingers around above the knee at the top, and I push the whole leg from the ankle up into my right hand that's above the knee. I'm pushing up and in, up and in. And again, I'm not pulling out ever, and the skin isn't moving. I'm just compress the joint, let go. Compress the
So
joint,
that's
let
what
go.
we were doing wrong, is pulling out.
Pulling out, and also a lot of the skin and stuff was moving, so it's really just the structures underneath.
If the skin's moving, that means you're not holding deep enough?
Yeah, or just maybe not holding deep or tight enough or something.
Okay.
And there's just too much like movement overall. It's a really tiny, tiny movement. And joint compressions are always done with the joint in a neutral position, so we don't do it all the way in extension, and we don't do it all the way in flexion. It's kind of like just the area where it would just lay on its own. And just like all of our exercises, just parallel to the ground.
Okay.